In today's Money Watch, we're focusing on potential cuts to Medicaid. As Congress hammers out a new federal budget, Republicans are looking to slash $2 trillion with a T in long-term spending. And Medicaid could be a target. That is very significant because more than 72 million Americans rely on the program for their health care.
Wow.
So let's bring in CBS News business analyst Jill Schlesinger to sort it all out for us. Jill, always good to have you at the table. But let's start with the basics. What is Medicaid exactly? Who benefits? And the difference between Medicaid and Medicare is what?
Yeah,
So
I mean, it's very difficult because they sound alike.
Yes.
They both came out of the Social Security Act of 1965, so it's 60-year-old programs. These are the safety nets that provide health insurance. Now, Medicare is health insurance for someone who is 65 and older. We pay into the Medicare system once we get to that age. Medicaid is for people with lower incomes or means. And for that program, it is funded partially through the federal government and partially through state governments. And as you said, millions, tens of millions of people are on this plan, ranging from people with kids to older adults. And in between, we have so many people relying on this system. It is incredible to imagine that this system is much bigger than the Medicare system, actually, with 70 million versus, say, 49 million in Medicare.
So it's not like the Trump White House campaigned on cutting Medicaid, but it's a fear that critics have. Why do they think that might be a target?
As you guys said in the intro, when you think about cutting $2 trillion, even if they don't get to two, let's say it's $1 trillion, you have to go where the money is. And the biggest spending by the federal government is Social Security, Medicare, and Medicaid. Now, Republicans have long said, and the president said as well, we are not touching Social Security, we're not touching Medicare. They've said they really don't want to touch Medicaid, but that's an $880 billion program. Wow. So if you look at where the money is, that's the fear. And if the federal government cuts back funding on Medicaid,
what should people do?
Then states are going to lose their funding. States will cut back on services. So there are a few different things to do. You don't have to do anything now. No one's cutting anything now. But you can go to the marketplace, healthcare.gov, right? That's one thing to do. You can reapply through your state. You can maybe apply through a workplace plan, but these are expensive plans, gang.
Yeah.
And Medicare for those over 65. I got to be clear also, the types of people this really does impact a lot, older people. So we have 60% of people in nursing homes that are receiving Medicaid. We have millions of people who are receiving Medicaid who are over the age of 55. Talk to your families, get a game plan ready.
So it seems it would affect the people that could least afford to be affected.
Exactly right.
Wow.
Jill, thank you very much.
Sure.
Appreciate it.